There's going to be a day when someone you love is in a hospital bed and someone else in your family asks, "What do we do?" And whether that moment is full of confusion or clarity depends on what you do today. This episode is about protecting your future self and your loved ones by putting a plan in place now. We'll walk through the documents you need, the conversations that matter, and how to turn something scary into something empowering. You don't need to have all the answers. You just need to start. So I think we've talked before about how you need to meet that 6-month or less prognosis requirement in order to be determined eligible for hospice care. But if I'm the patient or I'm the loved one of someone who I think might be eligible, what does that look like? I know I might be navigating different doctors or physicians and treatments currently. I might not know when is the right time to start thinking about hospice care.
For people that have serious illness, serious progressive illness, they've often been through the medical system. They've had a lot of different care, treatments, interventions, if you will, sometimes a lot of trips to the hospital. And, in people and their families are sometimes sensing that it's not working, that they're not getting better. They really want their focus of their care to be more on their comfort, that's what's appropriate for them with the stage of illness that they have. As physicians, I'd like to say that we're really great at this and that we help people identify this right out of the gate every time. And it's not necessarily the thing that we're best at, to be honest. We see people get referred late. Sometimes they don't get referred at all for hospice. So it's really important that families and caregivers kind of understand what's available for them and when they might need it. So I would say that when care and sort of the care that people are getting doesn't seem to be meeting their goals or isn't progressing, thinking about hospice, it's a new model of care. It's new for them. It's going to be comfort focused. It's going to be individualized, largely home based, and it's a chance to kind of hit the reset button on the type of care and hopefully make sure that their quality of life is maximized. It's really about whatever days people have left, living them to the fullest and having the best quality of life possible.
Yeah, I think that's really well said and paints the picture. The other thing that I would say is, while you still need a physician to certify that prognostication requirement, you do not need a physician to contact a hospice and receive your initial assessment. So if you want to reach out to a hospice in order to have that assessment, they will come out to your home and see if you're eligible for hospice care and then begin that process from there. So if you don't have a physician contact in order to help make that referral, or if you're just feeling like the system is not working for you, don't be afraid to contact the hospice and see if it's appropriate. It may not be, in which case they'll wait until the care, it's the right time for care, but it may be, and then you'll get the support that you need. And so also just don't be afraid to start the conversation yourself. Go to your provider and say, what do you think about that? Am I appropriate for that type of care? Being your own advocate, even if you don't have the answers, if you just have the questions, you can get that conversation going.
For sure. And I mean, ideally, this is a great partnership between a person's medical care team or their primary doctor and the hospice. That's the best case scenario. People are working as a team, there's good communication and coordination, but of course, hospices in all communities will take any family's call and talk them through the circumstances, maybe come out and do an assessment. I think ideally, people learn about hospice in their community even before they're struggling with these issues. I'd recommend people knowing about the different providers in their area. Actually, one part of the hospice program is volunteering, and if people are looking for a meaningful way to get involved in their community, being a hospice volunteer is a wonderful way to do that. But I think that being an advocate for yourself, for your loved one, getting to learn more, reaching out is really a good recommendation.
Yeah, I'm glad that you mentioned the volunteer plug. I had a personal experience with hospice care in my family, but then when I first got professionally into hospice, it was through volunteering actually for a local hospice house and spending that time with those patients. And in this case, they didn't have anyone else to spend time with, so it really was just sitting at the bedside, sitting vigil and helping to hear their stories or just keep space for them to feel like they had support was transformative. So definitely encourage anyone who's interested in getting involved. You don't have to be at the bedside. You can do administrative support. But for me, that was a transformative experience, especially because I'm not clinical. So it was kind of my sneak preview into what it would be like to be at the bedside.
Any on that, Elyssa? Any like scenario or circumstance that you remember with your experiences that really stands in your mind? Any specific situation you'd want to let people know about?
Yeah, I mean, there are lots of stories that I could speak to. Most of the people that were in this hospice house had very little means. They didn't have any family. In many cases, for good reasons, they were skeptical and protective over themselves and their stories. And so I think over time, and I went for basically my entire senior year of college to this hospice house, and some people were there for multiple months at a time, as you know, they typically can be. And so I got to see them every week and check in with them, and over time to watch the way that people opened up once they felt cared for and supported for, once any pain was alleviated, so they weren't distracted by the level of pain or the symptoms that they were experiencing, and they had the opportunity to tell their stories. So for me personally, as a little English nerd, I loved being able to, you know, with their consent and permission, of course, to document some of their stories, and some of that made it into my thesis. I got to share these stories that would otherwise have been taken to the grave with these folks, and now they get to live on and to help inspire other people. So yeah, I mean, it was truly transformative. Some veteran stories that were able to be shared and passed on because of that. So just making sure they felt supported really enabled a transformation.
Yeah, I think that, so we talk about comfort, okay? Hospice emphasizes comfort care, and that there's a lot of layers to this. And of course, what comes to mind is pain, right? Mm-hmm. And this is a big human fear, right? Mm-hmm. The idea that we would, suffer in pain, from some type of condition and that not be addressed, that's a horrible thing to think about, right? And it's a horrible concern. And unfortunately, there are medical conditions that can be very painful, like, physical pain. And a big focus in hospice, a big area of expertise, are modalities to try to manage pain, right? Whether that's medications or non-pharmacological interventions, hospice teams are experts in addressing that type of pain. There's other symptoms too, other physical symptoms that are common that we try to help people with. Things like shortness of breath, anxiety, gastrointestinal symptoms, nausea, vomiting, other uncomfortable or truly radically distressing things that hospice teams are good at trying to help people through. But then there's a whole other area of comfort that I think some of what you were talking about gets into, which has to do with the loss that people are experiencing, the issues around people's relationships with their families and their lives, their legacy, issues and thoughts and feelings around people's faith and their relationship with a higher power. And these things also are addressed by hospice. That's amazing, right? So this is not just like a medical intervention, like a box of pills. Okay, hospice teams, volunteers, people like you that get involved, and also the staff. We have chaplains as part of the hospice team, and spiritual care as part of hospice, and often social work. And these individuals are really skilled at helping address some of these broader psychosocial, human issues. And that's a source of comfort for people and families, finding ways to get resolution, or at least know that their story was told, or they said what they wanted to say. That's a big deal.
Yeah, let's dig into that more. We started to talk about the different members of the care team. So let's just say the hospice certifies that you're eligible for care and you begin to receive treatment. That treatment can start as soon as you need it to, as soon as the hospice is able to provide it. and they'll work with you to create a customized care plan that's specific to your needs and wishes. And then who helps provide that care? So you mentioned a lot of the different disciplines. What could that look like? What could a care plan look like for a patient? How would they feel on a day-to-day basis receiving hospice support?
I think there's two words that are used here that are really important. One is individualized, okay? Hospices will make an individualized care plan in working with a person in their family, trying to understand their circumstances. So the set of services are going to be individually tailored. So it's not a one-size-fits-all kind of thing. The other thing is that care plan is made in an interdisciplinary fashion, meaning it's not just a doctor's plan or a nurse's plan. It's going to involve a broader care team, some of the people that we've talked about, the social work, the chaplain, AIDS services might be part of this. AIDS, home health aides are critically important in hospice care. They're often providing direct hands-on personal care, helping with other aspects of the basics of life in a person's home. And so that care plan is going to look different for different people. It might be the case that for somebody whose primary issues or concerns, let's say, are pain management, and they're concerned about getting their pain under control from a particular condition they have, they might be receiving a lot of nursing visits to review their medications, the nurses might be working with the person's physician to get to the right dose or the right type of medicine so that the pain is as best possible addressed. And then, there might be times when, the services are visits from a chaplain or social worker looking at the whole caregiving picture. How's the family functioning? What are the person's more existential needs and feelings and or the families? And how can these be addressed in a meaningful way? Actually, hospice care extends past a person's death. And so it's important to note that what we call bereavement services are part of hospice. So if you're a family member, loved one of somebody who received hospice care, after they've passed away, there's going to be support offered and help with grief and coping. And so that's an important part of what people can expect as well. But again, a lot of the care is at home. So a lot of this is delivered through home visits and people coming to your home to help with this myriad of issues.
Yeah, and I think this may seem like a small point, but it's just something that I've heard a lot. They don't surprise you. You know when your care team is coming for the most part. They'll call you on the way, or if they have to change something out, they'll let you know. I just say that because it can be scary to let someone into your home, but these are vetted, trained professionals, and they work with you to come when you're ready for them. I actually remember this one patient that I used to visit, and she didn't want anyone there unless she did her makeup for the day. And I relate to that.
Yeah.
So she would use all of her strength to get ready for the day and then be sitting propped up in bed for her visits. And so it was a big deal for her if the schedule changed. And so the care team knew, we don't just change things up on her. It's very important to her that she's ready. So there are things like that where you wouldn't learn those things in a normal care setting. These people are embedded in your home. They get to know you. And that can be really, can open up another level of trust that you might not get in other care settings.
Yeah, I think it's a great point that hospice, it's not where the home visitors are just going to show up unannounced. That part of that planning and part of that care delivery is teamwork with you and your family around the right times and the right ways to get the care that you need. And that, when hospices are at their best, all those basics and those small nuances around a person's preferences and personality and scheduling issues, those things are taken into account and addressed, of course.
Yeah. The other thing that I want to touch on is having conversations with your care team or with your family members. And I know we'll talk about advanced care planning. That's a whole nother episode. But just more, asking questions about your care, getting your questions answered from your care team. I would say as a starting point, don't be afraid to ask. That's what they're there for. Like, what can your social worker help with? Maybe you don't even know what to expect. Maybe you think you don't want spiritual support, but then you learn what that really means. So asking questions, being unafraid to collaborate with the hospice, and you can ask your nurse a question. If they don't have the answer, they'll go to the aide. If they doesn't answer, whoever it is can help provide that support. So any tips for patients and families navigating that and understanding what could be available to them?
Yeah, I think that there's so much fear, there's so much anxiety. It's, people with serious illness, and they're managing through some really tough times, and it's easy to put up walls. Okay, that's our human nature, right? When we are afraid, when we're worried, when things are not going well, the walls come up. And the thing is that some of the most meaningful and beneficial things within hospice require a relationship, right? They require, at least letting somebody in, letting in the nurse or a chaplain or aide or team member. And I think that, some of the best stories that I've had in terms of families that have gotten the most benefit and people that have gotten the most benefit, it's because that they were able to go from that feeling of fear and, even some degree of cynicism or skepticism about whether or not this was going to help, to just giving some of the team members a chance. And once they form those bonds and have those relationships, there can just be such benefit. And, why beat around the bush about this? You don't think about, we don't live our lives and our days thinking about, it'd be nice if we need hospice at some point, right? This topic is not always easy, where we are focused on living and want to we want to live forever often, right? And this whole area where we're coming to grips with prognosis and new goals and hoping for something different. This is hard stuff. And I can't, I've had family experiences, but not, I've personally not needed the, care from a hospice, of course. And I don't know, I feel for people that are having to work through these thoughts and feelings and stuff. I've just seen it enough to know that this is one of the most wonderful areas of healthcare. The people are just through the roof incredible, and give them a chance.
That's an important point to touch on. Nobody's defeated death. So we know that, yet it's hard to actually logically digest that information, and you're going to try to find all the different things that you can do. And actually, not to share another personal story, but I will. And I've already shared the story of my dad and his hospice experience on the podcast before, so I won't go into full details, but there was just one thing. So my father, he, battled, and I use the word intentionally, for years and years, trying all the experimental treatments, all the trials, Mass General Hospital, the whole kit and caboodle. And when he finally came home on hospice, I've already spoken about it. It was the best experience of those 6 years, was those 6 months. But he was still, he was very logical. He was very driven. He was a lawyer. He wanted to analyze things and find the correct solution. And so he kind of exhausted his options for experimental treatments. And that's the only reason he chose hospice. Now I know, to me, it was presented as giving up, but that is not what I understand it to be in reality. That was the best quality of life that he had, and it was anything but giving up. It was choosing to live well for the time that he had left and to make those memories. But one thing that I think about is so curious, to your point about building relationships with the care team and letting them in. Where I was growing up, there were a lot of experimental East meets West treatments that hospices could bring in. It was popular, and a lot of patients asked for them because that was just popular in the area. And my dad was very much, no, I want the classic Western medicine approach. But as time went on, he was like, well, let me try one of these things. So he actually had a Reiki healing modality, and that is something that my dad would have not normally been open to. But he really loved the experience and benefited from it. And I can't speak to the specifics of how that actually works, but I know that he had an emotional response that was beneficial to him. So all that to say, like you're in a different mindset than you're normally in, trusting your care team to be there as a partner for you, trying new things. That could provide you with a different level of emotional healing that you would have in another setting. So yeah, you just never know. And also, it was incumbent on me as a caregiver and my mom and our family members to keep the door open and not say, oh, he wouldn't want that. Because we don't know. Like this circumstances have changed. We don't know what it's like to be in that person's shoes. So a lot of really profound things to be thinking and talking about, but it's good that we're thinking and talking about them.
Absolutely, and thank you for sharing, and really important insights. I think while we're on the topic, I want to emphasize that many cases, actually, people live longer in hospice. So I wouldn't want anybody to think that hospice is in any way about shortening somebody's survival. In fact, sometimes the medicalization of the last days of life can actually hasten somebody's demise, right? There becomes a moment when certain therapies and certain treatments actually are not just not helping, they can be harming somebody, right? And I can think of many scenarios with people that I've cared for where when we stop the cycle of going back and forth to the hospital and we get more judicious about which medicines are really going to help them with comfort versus, not really help at all, and focus on the basics, people tend to perk up a bit, actually, and often string together a number of good days, if not months, where they are more stable. Of course, all people getting hospice care have an underlying, life-threatening condition, and it almost always, takes its course. But this is not in any way at all about shortening life. And I want anybody who's thinking about hospice, or whether they're thinking about what's the right next step in their care, hospice is not in any way about shortening their life.
Yeah, I'm glad you went there. I think that's really important to underscore. And not that this happens all the time, but it is possible to, what a lot of people say, graduate from hospice. So, they'll continue to check your eligibility for hospice. But if your condition does become so stable that you improve and your prognosis is no longer within that 6-month requirement, you can be discharged from hospice care and continue to receive other types of appropriate care. And then, when it does become appropriate for you to resume hospice care, get back on those services. But it happens. Like, that's not a common thing to, I don't want people to hold out hope for miracles, but just to know that your condition really can improve on hospice care. You're absolutely able to extend life in some cases, and you're certainly not giving up by choosing that type of treatment.
Yeah, Elyssa, one of the more famous recent hospice patients, our former president, Jimmy Carter, who recently passed away. He had been in hospice care for 19 months. And, we've heard in public some gratitude from his family about the care that he received and about how he was able to live out his final days at home. Of course, with hospice, at any given moment, the assessment would have been that it wouldn't have been expected for him to live more than 6 months if a disease runs its normal course. And it's just another example of where we can't explain things always. Okay, maybe some of this is just, there are things beyond human prediction and human control that are at play. But when somebody gets really good hospice care, and also they stop getting treatments that may no longer be helpful and sometimes may even be hurting them, they can have strings of a slower decline and can have some good days. And so I would just really, really want people that are thinking about their care options and that are thinking about their family's circumstances to not consider, that one type of care is going to be life prolonging where another is not. Now, when we're talking about, somebody at the very, very end of life and all their organs have failed, and it's a question of, do they continue, on a ventilator or not? Of course, we know in those circumstances that, we withdraw the, ventilation. Often the person will, we don't know exactly how long in those circumstances either, that sometimes people will survive longer than we expect. But, in those cases, the ongoing care is typically futile and not really adding any really meaningful continuation. But a lot of the scenarios, it's hospice is that the care is just so personalized, comfort oriented, and people can and often do survive a bit longer.
Yeah, I think that's a good place to end it. That hospice focuses on quality, and in the words of Guy Fieri, the hospice care team are angels on this earth. So I don't think anyone can say it better than him.
There you go.
We spend a lot of time talking about how to care for someone during their life. But what happens to their loved ones after they're gone? In the next episode, we're diving into bereavement services in this country, what they look like now, and what we can do to expand them. See you there.